strong therapeutic technique regardless of diagnosis.
Okay. Let me turn to the next page, Clay. It's 3833. And this is page 2 of your note. I'll direct your attention to the top. Do you recall, or does this help?
We're looking at the notes. We want to bring in our psychology expert. She has taught psychology at Temple University. She's also an author and a nationally recognized parenting and relationship expert. The title of the book, Building Self-Esteem in Children and Teens Who Are Adopted or Fostered. Dr. Sue Kornbluth on the program there. Dr. Sue, tell me, if you were able to evaluate both Maya Kowalski and Beata Kowalski, and if you were trying to get to the bottom of whether or not there was Munchausen by proxy happening with Beata affecting Maya, who do you think it would be easier to get to the truth to, and why?
Oh, this is a loaded question, Julie. I mean, look, first of all, it is very, very difficult to diagnose this disorder. It's very rare, and so therefore it's extremely difficult. Who could we maybe get it out from easier? It depends who the person is that is interviewing Maya and who is interviewing the mother. I think with Maya, what she needed was someone to interview her that could be really compassionate, wasn't there to trick her, would ask specific questions about what was the routine with mom when you woke up in the morning till late at night. Was there ever times during the day where you were able to run around and move and do things? Did you feel coming to the hospital caused you a lot of anxiety and fear? Was your mother telling you that you must take your ketamine every single day? Those are some of the questions that I would recommend people asking. With the mother, on the other hand, she was very, very aggressive in the way that she was talking to people at the hospital and talking to other professionals. You could hear that and see that on the documentary. She really would need somebody that would not trigger her defensiveness. Mm-hmm. So somebody that could maybe side with her, see what she was going through, to bring out that she really has been struggling herself too, and perhaps that she didn't mean to do this, so on and so on. But you never want to suggest anything. But there is no way that you would get through to the mother with somebody that was interviewing her that was aggressive.
Right, has to, I suppose, just be elicited in a very gentle, calming kind of way. I asked that question, Dr. Sue, because it fascinates me. You know, psychology fascinates me. I wish I could take one of your classes. And when I'm thinking about this, I'm thinking, so sadly, Beata's deceased. We can't ask her any questions. Maya's alive. If Beata were alive and they both were, like, who really... Does Maya even know how she's been affected, if she has been affected in this way that the defense says she has? So I guess that's why I'm wondering, you know, who might be able to give more information that's helpful.
I don't think she would recognize. She was so young, and then as she got older, I don't think she recognized what happened to her. She may now and not want to say anything, but there was one specific point in this documentary that really stuck out to me. And it was when Maya used the word sedation. She asked the nurse to be sedated. What 10-year-old, Julie, knows the word sedation? So that makes me question, where did she get that word from? The mother?
Right.
That's what we're trying to find out.
Right, Dr. Sue. No, I mean, you're a parenting expert. You're an expert in the field of psychology. This is very, very sad. And it was alarming to those doctors, too. They've testified in this case that when the child is asking for ketamine, And they're wanting it in very large doses. This child is 10. They testified to some throwing of fits and some very bad language and different displays of behavior when mom was out of the room versus when mom was in the room. So as we always say, two sides to every story, that is for sure. Dr. Sue, we'll have you back